A very good evening. Hereby, I am Dr. Anand would like to present the research methodology for the impact of thermal discomfort at healthcare industry kitchen area over the workers' health. The study was conducted to understand the effect of heat discomfort over employees' health due to tasks performed at cooking area in food processing plant. Cooking area is a critical part in food processing plant which usually overlooked by management. Employees are exposed to working environment for an average of 8 hours per day for minimum of 5 days a week. Working under temperature above recommended level by OSHA is certainly exposing employees to experience physical, physiological and psychological changes. Such discomfort could affect employees' attitude and behavior on job satisfaction and task performance. In this study, we will determine the relation between thermal discomfort and healthcare kitchen workers' health, which eventually influence their attitude and behavior towards work satisfaction and performance. Therefore, it is essential to know this relation in order to prevent the negative outcomes such as worker turnover, injuries, incidents, and accidents. The research background. Working environment directly determines employees' health, work performance, and job satisfaction. Hence, keeping pleasant working environment should be a prime goal. OSHA 94 Part 4 Section 15 General Duties of Employers stated the importance of providing safe and healthy working conditions to employees. The purpose of this study is to understand the need for pleasant working environment, which consists of clean air, optimum temperature which sum up into healthy environment. Thermal discomfort, also called as indoor environmental quality, describes how indoor temperature, air and humidity can affect employees' physical, physiology and psychology, which total up into work performance satisfaction. Employees spend an average of 8 hours per day for minimum of 5 days per week in a workplace. Therefore, it's very crucial to know on how to provide employee with ambient work atmosphere so that employee will feel comfortable with the physical condition of workplace. Working under feasible ambience increase job satisfaction and work performance. This awareness is in tandem with providing safe and clean working environment where employee welfare is taken care. Problem statement. According to Filcher 2002, human physiology, physical and mental has certain limitations to withstand thermal discomfort. In the event, workers were exposed to heat beyond tolerable state for a certain period of time. It will yield into some negative outcomes such as high absenteeism, high turnover injuries due to fatigue, stress, lack of job satisfaction and productivity, and etc. Increases indirect costs as high turnover rate, absenteeism, etc. will drain organization time and resources to manage the issue constantly, where it could not disrupt production due to shortage of manpower. To comply FMA 1967 and OSHA 94, requirement is important as both legislation were meant to create safe and healthy working conditions. Any deviation could subject to legal action. Therefore, maintaining pleasant working conditions is crucial for working safety and health. Higher temperature prone to cause more fatigue. Thermal discomfort also lead into poor working environment, which lead into low job satisfaction. As per classical and contemporary theories of motivation, which suggest the same concept where employee with the low job satisfaction will exhibit a negative behavior such as absenteeism and disobey rules. Research objective. To prevent accident and injuries to workers due to fatigue. To address human limitation if exposed to thermal discomfort at working place. To establish safe and optimal working conditions at industrial kitchen. To address indirect costs occur if such condition persist for a prolonged period. To enhance hospital reputation by compliance to legal requirement. Research question. What was the human tolerable limit once exposed to hot working environment? What are the best solutions we can recommend? How to design and build best industrial kitchen which minimize heat exposure or release? What is optimal working environment at the kitchen area? The significance of the study is to ensure workers' safety and health, increase workers' job satisfaction and task performance, no legal implication, prevent indirect costs due to accidents, absenteeism, and enhance organization reputation. The scope of research will study workers who are exposed to cooking area constantly and periodically. Food cooking area was chosen, which acts as a crucial part of food preparation for the staff and patient at hospital intent. As a reference worker from other departments also will be included in the study, so to compare if there is any significant impact experienced by worker at the cooking area compared to worker from other departments. Hypothesis. Based on background study and problem statement, we can draw a hypothesis which suggests to us that if an employee being exposed to heat above the OSHA recommended temperature limit, the employee tend to have thermal discomfort which results an impact on their health. The thermal discomfort basically affects workers' health, job satisfaction, work performance, legal requirement, and company reputation. The methodology will be first started with research design, subsequently research sample, sampling technique, data collection procedure, and method of data analysis. These are the fields being chosen, that is the processing area and also the cooking area. Research design. The purpose of research design is to provide a plan of study that permits accurate assessment of cause and effect relationship between independent and dependent variables. In this food processing plant, we have identified a group of employees working at the sampling selection area to ease the study. The research design used to evaluate the employee health and job satisfaction based on working environment due to the impact of indoor air quality. From the area, we choose the correspondent from the cooking area, that is about 16 workers, and processing area about 16 workers who act as a respondent. The questionnaire have three parts. There's a part 1 will have a personal detail, which basically we highlight about the participant gender, nationality, age, and education. Workers' health records will be on the part 2, in where does we get the data information from human resource department, and part 3 will be the structured questionnaire, in where does to identify the root cause problem. Is stress risk assessment performed, and work focus on workers' feeling and opinion, example how they feel about working condition being evaluated. The research sample is about 32 workers, where 16 workers from cooking area and 16 workers from processing area. In total, 32 questionnaires were prepared and passed to the workers. The selection criteria for the worker based on their area is the cooking or processing area. We choose this side is significant different from each other in many parameters. Thus, in our study, the participants choose to be a part of the study are the workers and their supervisors. So, in a way, we can conclude the sample was selected based on the selection. Stratified sampling technique is a probability sampling technique with the researcher divides the entire population into different subgroups or strata that randomly selects the final subject proportionally from different strata. For this study, I have selected two sections, cooking and processing section, which hold two different working environment with or without much dispute. The IAQ has influence on the workers. The data collection procedure in a research is the stage where useful information is gathered according to objective of the study. Primary source of the data of the study is from the result obtained via questionnaire which was filled by the selected respondent from each area. The questionnaire was distributed among workers and cooking and processing section and collected once being answered. The method of analysis based on will be calculated in percentage, and the questionnaire which was written by the participants is also reviewed back manually before the final percentage calculation using the Excel software. Hence, the calculation will be the methodology able to help researcher evaluate the effect of indoor air quality over employee, that is at the cooking and processing area. A few areas such as level of job satisfaction and health factors, which supports the topic of the research.